Hey everyone, welcome to the show today, my so-called fabulous. I'm Tiffany. Welcome, welcome. And you know what, y'all? We're here to solve a problem every single Tuesday. So I've done this 6.5 years of this show. This is season 11. And Dabney, I went to Dabney when I had breast implant illness, and she coached me through that. She is fabulous. She's with Restore and Revive, and I'm going to introduce her, but we're talking about hormones and stress and prevention and what it really means to invest in your long-term health. And this phase of life for me, it's investing in my long-term health, especially with women over 40. So many of us told that exhaustion, brain fog, weight gain, anxiety are just aging. But what if they're not? So joining me today, let me tell you a little bit more about Dabney. Dabney Poorter, family nurse practitioner, founder of Restore and Revive in Fort Worth. If you're not familiar with it, look it up. If you're in Fort Worth, you know all the details. She has over 20 years experience in her own journey with type 1 diabetes. Dabney brings clinical exposure and personal insight to functional medicine, and I know that for a fact. We're going to dive into perimenopause, good grief, advanced lab testing, what's necessary, what's not, prevention strategies, and even the conversation around the tools like scanning and MRIs. If you've ever worried about your feeling is normal or if it's not normal, you're going to hear it today. Welcome to the show, fabulous friend.
Thank you so much for having me.
You're so welcome. And she goes to the same gym I do, and I see her on occasion. She's one of those 6 a.m. people like me. Dabney, tell me what's going on. Tell us about Restore and Revive and how long you've had, as long as I can remember, but how long you've had Restore and what it is.
Yeah, great. So happy to be here. Thank you. And I'm proud of you for all that you do.
Thank you.
Restore and Revive is a wellness center here in Fort Worth, but we are grounded in functional medicine. So our functional medicine practice plays a huge role in our treatment of our clients. But you don't have to be a patient of the practice to come enjoy the wellness center. So that's an important component.
You don't have to be a member.
You do not have to be a member. You do not have to be a patient. You can come and do any of the modalities that we offer through the Wellness Center. But we really have tried to ground ourselves in the functional medicine approach so that we can see our patients. So whether it's one of our nurse practitioners, myself, or a PA, we have a DO, and then we also have a full pediatric practice.
Yes.
So
I just saw this.
Yes.
Okay.
Yes. So we are so excited. We're actually bringing on a new a pediatrician. We have a family nurse practitioner that's currently our pediatric provider, and she's amazing. We love seeing the whole family and getting to help them from any and everything, whether they're wanting to optimize or whether they're sick, and we're wanting to walk along their journey with them and help them in the healing process.
Right. You also have Pilates. You also, you have all kinds of therapies, ozone therapy. I've done them all. I've done them all, literally all of them with you. The foot soak, nasty.
Yes,
but it works.
It can be gross. It can definitely be gross.
So I'm so proud of you to start it. I mean, just what a resource and a wealth of information you and your team are to this town. It's amazing.
Thank you.
So you and I also share something. I have a family member that has type 1 diabetes. You have type 1. How did that shape you being in the medical world, or did it?
Yeah, great question. So interestingly, I was not diagnosed with type 1 until I was 26, but my brother was diagnosed when he was 6 years old, and I'm 8 years older than he is, and so I still remember going to Cook Children's Hospital after his diagnosis, seeing these amazing nurses, and that were, walking along with my brother. It was Halloween weekend, so a terrible time to be told, hey, we need to monitor how much sugar you're intaking, and so in that process, I knew that I wanted to do something medical. I didn't know exactly what that was going to look like at the time. I didn't know if I would do more nutrition education or be a diabetic educator, but I knew that I wanted to be able to support a family when they were getting a rough diagnosis and being able to answer questions and helping them. So so then when I was diagnosed, I had a 7-month-old, and was post-pregnancy, and again, 26, had just run a half marathon, was working as a neonatal ICU nurse. So it was a shock for sure, but I felt like, first of all, my parents did a fantastic job making a lot of the needed changes with my brother. That not did they just do it with him, they did it for me. I played basketball and I ran track in college. I was very health conscious, was living a very healthy lifestyle. But we'll talk about this more, but something can always trigger an autoimmune disease, and type 1 diabetes is an autoimmune disease. And the really hard thing about what I experienced in the medical field after my diagnosis was being treated just like another type 1 diabetic. No one was asking, why did you get this?
Yeah.
What are other things that we should be optimizing because of this new diagnosis? How do we prevent other autoimmune diseases? And that's where I started getting curious and started doing a lot of deeper diving for my own health, and then it brought me to what I do today.
Wow, that is amazing.
Thank
That is amazing. I just have a friend last week, daughter went to Cook's, diagnosed at 11. So and just, you know what I said? Call JDRF because they will help for sure. We're both involved with JDRF, juvenile. I can't even say it.
And actually they changed their name this year. It's called Breakthrough T1D. So,
okay.
But yes,
all right,
it's an amazing organization that does research for helping. I mean, I really feel like their goal is for us as type 1 diabetics to live a healthier, easier life and be able to manage type 1 more easily.
Right.
But then they're also doing some really, really cool thing with early detection and at least increasing the amount of time in which someone would get type 1 diabetes. There's some new really cool things coming.
It's so
out
neat.
and-
So neat.
yeah.
Well, thank you for all you do because I know you do a
absolutely.
lot. Okay, let's dive into hormones. Women over 40. When do you see women that are in perimenopause?
Yeah, great question. I was thinking about examples of patients, and I honestly had two 37-year-olds in my office today, different patients, and really perimenopause starts in your 30s, and it does depend on, genetics. So looking at when your mom or your grandmother went through menopause, but perimenopause really can start as early as your 30s. And there's lots of signs and symptoms that we ignore at the beginning, and I think it's really important for us to talk about, what do we do, and how do we dive into that more?
And what are those symptoms? I know them all too well, but
Yeah,
what are
absolutely.
they?
Great questions. I think the biggest one is, joint pain, brain fog, even a feeling of like, man, I didn't have trouble focusing in my younger years, and now all of a sudden I'm having difficulty focusing. Sleep disturbances, maybe even PMS symptoms that you didn't have before, breast tenderness, heavy periods that maybe shorten. Those are all very early signs that there's something going on hormonally.
And obviously missing periods and sporadic periods. Oh,
Yeah.
gosh. Yeah.
Yep. And that's really later in menopause, So if we're already at that point, we've probably missed a little bit of that perimenopausal window that we could have been supporting earlier on.
So Dabney, I was back in my previous guest right before this, we were talking about this because I started bioidentical hormones. I started with progesterone capsules, and I started when I was 40-ish, and it was sleep, and we didn't talk about it because it could cause cancers, was what the research, the people would say to me, aren't you afraid? And I didn't talk about it. Now I scream about it now. Then moved on to testosterone and estrogen, DHEA.
Yeah.
Is that something you handle?
Yes, ma'am. Yeah.
You love it?
I do. I love it. And, I'm a believer in let's catch it early, right? So if we catch this in perimenopause, we can do things that are these, lifestyle things that are going to help support the system and help the transition in that period to help decrease the severity of symptoms and the stress that can be on the body.
Yes, the stress for sure. I think, if my memory is right, I was very well regulated and had a very good perimenopause. Very good. I was like, this is it. This is great. Well, I was taking bioidentical supplements and supporting. I had good care, and then I reached a time in my life. I met you, breast implant illness, and then had the breast cancer scare, and everything went to hell. I mean, it just went crazy. And I wasn't being consistent, but then I got back.
Yeah.
So isn't that proof?
Yes, absolutely.
Did people question that with you, or is everybody understanding now?
I'm still getting a lot of questions. I think younger people are now seeing and hearing and researching on their own and feeling more comfortable and confident in knowing that it's very safe to do hormones. You know, it's very safe to do bioidentical hormones. It's very safe. You know, we start very low and slow. We wait until it's needed. We're monitoring. I think there's, a lot of misinformation about how often you should be checking levels and what other things should you be looking at. It's not just sex hormones. There's other labs, other things we can be assessing to make sure that we're optimized.
Right. And what are those hormones? Like, can you share with us? Because some people are just eyes wide open at this point.
Yeah, absolutely. Our full hormone panel includes everything from your female sex hormones to the precursors for male and female sex hormones, such as pregnenolone, DHEA you mentioned. We're looking at a full testosterone panel, so not just looking at how much total testosterone you have, but the free testosterone that's there is really, really important. Then, we're looking at full thyroid panels. We're looking at these nutrients like vitamin D that all help. And then I'm really, really big about, of course, with my type 1 diabetes, making sure that we're optimizing our blood sugar balancing. And I think that that's really, really important. And we see huge shifts in that with insulin resistance and things that can happen really early. And if we're not looking at more than a hemoglobin A1C and a fasting blood sugar, we miss it. We miss the early signs and symptoms. We miss the early onset of it if we're not looking at things like C-peptide, insulin levels. There's actually an insulin resistance score that we like to check as well. That's really, really important too.
So testing is important.
Testing is important.
How often should we be tested? I do it every 3 months, but I'm just trying so hard to age it well.
Yeah, that's a great question. I think every 3 months is really, really optimal. I think early, if we are putting someone on hormones, we may test a little more frequently, every 8 to 12 weeks, just to make sure that we've gotten everything balanced. And then, we can space it out. 6 months. I usually don't go the full year, usually 8 months. 6 months is about the amount of time, especially if I have someone on medications that I like to keep evaluating.
Because things change.
They do. They change quickly, for sure.
Which brings me to my next topic with you, stress and then the central nervous system. You and I were chatting a couple of weeks ago about young mothers going through stress and then marriage and then life and jobs. How difficult is stress truly? Because I feel like I'm stressed a lot, and I just like, what am I doing to my body?
Yeah, that's a great question. I feel like for me, I laugh. I say there is a lot of stress that we're not going to get rid of. I'm not giving my children away. I'm not quitting my job.
No.
There's a lot of things, and my husband is probably not going to change. We've been married 21 years, and he's probably not changing some of the things that he does that cause more stress. It's not going to happen. But I think what we need to do a better job of is managing the stress that we have control over. And if there's things that are out of function, out of whack, that we need to address, such as getting better sleep, our nutrition, our type of exercise that we're doing, those are big ones, and so the stress does have a huge impact. It can cause inflammation, it can cause cortisol levels to be high, which cortisol actually affects your progesterone levels, so it can cause then these sex hormone imbalances. It can cause insulin issues, which insulin's a growth hormone, so if we're producing a ton of insulin, we're going to gain weight, and we don't talk about that often enough, and how we need to balance blood sugar and insulin levels, and insulin is as much a stress hormone as cortisol is. So
how can we balance that?
Yeah, great question. Again,
I don't know.
Sleeping more, I know. Sleeping more, strength training instead of really high intensity exercising. Strength training is huge though. Building muscle mass is so very important for a multitude of reasons. It helps us with aging, it helps decrease our risk of insulin resistance, because actually our muscle carries our insulin receptor sites. So that's really, really important. Drinking filtered water, removing toxins from our system can be really helpful. certain vitamins, that do help us, whether it may be a adrenal support supplement that we may look into for our patients. There's just so many things. Red light therapy can help, but I think if we just could wake up and go look at the sun every morning instead of our phone being the first thing that we look at, having a better relationship with our technology and the phones that we have, and putting them away more often. There's little things that I think are in our lives we could definitely do to help with stress.
Hey, I got my weekly report on my phone. I had 4 hours less last week. I'm like, how? What did I do? Did I miss something?
Right, what did I miss?
Did I sleep a day or something? I don't know what it was. Well, hormones are, the key to life. And I'm finding the lack thereof, for sure, with all of the things going on. Because now I am, I don't even know what we call it. What do we call it? Postmenopause?
Postmenopause.
I can't stand that. I can't stand that. So I'm like, oh my gosh, I'm finished.
Yeah.
But it's just, it's like my last guest says, that aging is in your head. But postmenopause, it is like you thought that you were just put out to pasture.
Yeah.
No, but with help and hormones and diet and so much, we got this.
Yes, we do. We have it, and we can help, and we're, I think, I don't want to ignore it. I think it's so important for us to, I had a patient today, she said, she was 67, and she said, this is the first time in my medical journey I've ever been heard. And that is what I think I saw with my own journey, is I finally found someone that listened. They took the time, and we heard them. And so we're able to take a symptom, and I tell patients all the time, just because your labs are within a normal parameter, the norm is not, those normal values that they give you are not what we're looking at in functional medicine. In functional medicine, we're saying, okay, first, it's symptoms. What's going on? What symptoms are you having? How are you feeling? What has changed? And then we're looking at those lab values, and we're not just taking them and saying, okay, these are this huge, long, from this number to this number is normal, right?
Right.
And it may not be.
And what is normal?
What is normal?
Yeah.
And I think, too, we're not testing early enough in someone's life to know what their normal actually was. And I think that is also really important, is to see trends over time. So again, trying to look at this earlier for these 30, 35, 40-year-olds, let's do some testing. Let's know what your baseline is, so that when things and changes do start happening, we're more aware of those things.
Hey, and this is a question I have personally, but my daughter's 26. Should she should test her levels, right?
Yes, yeah, thyroid levels. I mean, that would be thyroid, hormones, nutrient levels. Those would all be really, really important to test, between 26 and 30, so you have a baseline.
Because I don't have, I certainly don't have a baseline. But what a great present.
Yes, there you go.
There's a birthday present. I know. Okay, so hormones, switching over to screening. I did the Prenovo probably when I met you. It was just coming out, possibly. Did the Prenovo, and that was early detection. And I know my oncologist was like, why would you do this? Like, it doesn't really accurately measure breast cancer. But it found some other things, because it's dye related onto, I don't know what I'm talking about, that. But tell me about these scans and these tests for prevention and longevity. Tell us what your thoughts are on that, because it's here. We're here, right?
We are. We absolutely are. I actually did a Prenovo last summer.
You did?
I did, and it was great information. I valued it. I think with the Prenovo, I support it. I think it's a great tool. I think, some people, if it's going to create more anxiety, that can be a problem. I think also, it is later detection. Once you see it on a Prenovo or an MRI, it's already, stage 2, stage 3, if we're looking for cancer.
Right.
So I think it's important to do other screening tools, whether we do some blood work, we look at genetics. The genetics is really helpful. There's a few different options out there, but I'll say one. One is called MyRisk, and that's going to tell us our genetic and population risk of a certain type of cancer. And so if we know that information and say our risk is high, we're going to want to do screening more frequently. We're going to want to look at this. I have the MyRisk company told us a really great story. There was a 30-year-old, that she decided to do her MyRisk. The MyRisk said her risk factors were high, so every 6 months she started doing some form of screening to look for cancer. And lo and behold, she did get cancer at 35, and most of the screenings don't start until way past 35.
Wow.
And so I think it's important for us to, again, look at these values, understand how to read a CBC in blood work, and understand that there's ANA and autoimmune markers that we can look at that have these different levels that are even within that ANA analyzer that's going to give us indications of, hey, we need to dig deeper, we need to look at this more. And I think a Pronovo is great. There's so many other tools out there that we can consider. My biggest thing is to treat the person as an individual. So if they have a strong family history, if they have had a personal history, if they have concerns and they want to dig deeper, I always, again, the patient is the best diagnosing. They're going to diagnose themselves way before we are in most instances.
Know your body. Know your body. Yeah. We were talking about this before the show. Women have a difficult time taking care of themselves. Right now, longevity is so important, and we're going to talk about that in a minute. But do you find that because women having children, especially new mommies, having a difficult time prioritizing their health?
Absolutely.
We put it on the back burner,
Yes.
So are you dealing with that and this prevention? What are we doing? What are you seeing in your patients?
That's a great question. I had a patient today, actually, another story that I could tell she's 37, she has 3 little ones at home. And she said, the last time I remember feeling my best was pre-kids. And, and I said, well, what were you doing differently then? She said, well, I was eating really healthy. I was exercising. I was getting enough sleep, And again, going back to some of the things we cannot change, if we have children that are still waking up and, there's some of that may disrupt our sleep. But I always say, if I don't prioritize myself and how I am taking care of myself, one, I'm not setting a good example for my 2 teenage girls, but 2, I'm less able to take care of them. I'm less able to take care of my husband. I'm less able to take care of my patients if I'm not prioritizing my own self. And then if you think of it from a chronic perspective, if you don't take care of yourself now, what is it going to look like a few years from now? Are you going to be sick? Are you going to, So I think we need to do a better job of taking care of ourselves and prioritizing certain things.
And it's hard.
And it is hard.
It's hard.
It is hard.
So back to the screenings, what are the non-negotiable? Women over 40, there's no negotiation, you must get this done.
It's a good question. I don't know that I have a real big answer for that. I'm not a proponent of mammograms. I'm a proponent of ultrasounds. So I think ultrasounds are a key. I think that's a non-negotiable for me. Breast ultrasounds is a key. I think looking at symptoms within the GI tract. Are we going to do a Cologuard versus a colonoscopy, and when do we start that? What's family history? Or how about we do a functional medicine stool test and heal the gut and get rid of inflammation and other, whether it's parasites or overgrowth bacteria that we might want to heal in those areas. So over 40, I would say, breast ultrasounds is important. Your annual visits are really important, and finding a doctor that's going to listen to you and help prioritize more comprehensive lab testing that is really going to look at some of these cardiovascular markers that are really, really important. And if I see those off at 40, I'm going to have someone do a Clearly lab scan, which is a cardiovascular scan to look at risk factors cardiovascularly as well. And that helps us know whether or not, how aggressive do we need to be treating something.
Right.
I don't not believe, I actually strongly believe in conventional medicine. I believe we need conventional
Right.
medicine. You know, in those acute situations, it's really, really important. But I think what we're missing is we're not putting them together. You know, we're
Right.
not having enough conversations around how do we do prevention
Right.
and how do we treat someone in an acute situation.
Yeah, because you're a rarity. Your field is a rarity, because I know even just friends and family members that just they'll bring up, I'll bring up, you know, functional medicine, and they're like, whatever, you know. I mean, just, and it's not younger audience, but it's the older.
Yeah.
But I have to tell you this story. It's not on our notes at all, but I think I fell off the table. I went for my 60-year, I was turned 60 and went for my women's wellness. He said, okay, I'll see you in 2 years. I was like, what? I mean, I don't enjoy this.
Yeah.
But he's like, oh no, you're now every 2 years.
Yes.
And I'm like, but this is what, wait. I mean, I was just kind of in a panic.
Yeah.
And he was trying to tell me without saying it, insurance won't cover it next year. What in the world?
Yeah.
And I pay a lot of insurance
Yeah,
for insurance.
I know.
Is that true? It's true.
It's an uphill battle, yes. Insurance is an uphill battle. It's hard.
I was like, I
frustrating.
don't believe you. I'm going to ask Chat.
Yeah. Well, and I feel bad for these doctors too, because they,
Yes.
you know, they maybe don't know better, and this is what they're being told, but they
Yes.
also feel so handcuffed to
Yeah.
what insurance is
Yes.
allowing them to do.
Yeah,
So,
and I love my doctor. I mean, he's a specialty OB-GYN and an OB, and I couldn't believe it.
Yeah.
But he's like, I'll see you next year then.
Yeah.
I went, sure will.
Yes, I will be here.
I'm seeing you for a reason because I'm high risk. But that
Yeah.
was bizarre to me. But
Yeah.
that's a different podcast.
Well, yeah, definitely. But it is true. It is true.
It is
and it's, it's changing, and
Yeah. It's just changing. So we said we weren't going to talk about this, but I'm going to bring it up because it's just, our trainer asked us,
yeah.
peptides. Peptides, okay.
Yeah.
So that's a thing.
Yes, it is a thing for sure.
Yeah.
You know, what's interesting, I think people don't know about peptides is, I mean, insulin is a peptide. So I take insulin on an every single day basis. It's a medicine, right?
Insulin's a peptide.
Insulin's a peptide. And I think how I like to define peptides first and foremost is proteins are 21 amino acids and greater, okay? Peptides are 20 amino acids and less. So they're amino acids, and they each have a role and a purpose. Do I do all of them? Do I believe in every single one? Am I going to put someone on hundreds of peptides? No, but I think they're a tool that we have that we can use to help our patients optimize, heal, you know, depending on what their symptoms are.
Right, right. Because I'm dipping my toe into the peptide world. BPC 157 is the first one.
Yeah,
you know,
love it.
Pain and gut, right?
Gut, yes, it's huge. I mean, I have several patients that have either celiac or some form of gluten sensitivity, gliadinin sensitivity, which is the protein that's found in wheat. And it really, BPC 157 orally has been a game changer. Even just taking it for 3 months, it's really lessening the inflammation and really, really making a difference. But of course, we're not giving medical advice here, but you know, and it's very individual, and but it's worth having a conversation with your provider about for sure.
Right. Yeah. Are all peptides safe? For example, I do have a friend that's just getting them online.
Yes, no, absolutely not.
Okay.
That's a great question.
Excellent question. You heard it right here.
Excellent question. No, you know, it's similar to a supplement, right? There's lack of regulation still in that industry, and so you definitely need to work with a provider and get it prescribed through a trusted source, and not just go and buy it online.
Right.
Yeah.
Because but peptides have been around for a long
time.
A long time. But people abuse that too.
Yes.
Of course they'll abuse that.
Yeah.
So.
Yeah, there's people looking to make a penny, and
of course.
So they're gonna, you know, but yeah, we don't know where we're getting. I think we have to be really careful where we source anything. So
Dabney, I feel like I am on so many supplements. I'm just like, I need a supplement vacation, and then my labs go down or whatever. Is there too much?
It's a good question. Yes, absolutely. I mean, they counteract each other. So this is why looking at blood work, getting a sense how you feel. I even would say, I mean, I have patients that bring me, suitcases full of supplements. They set them on my desk in my office, and they're like, which one should I be taking? I'm like, well, you know.
All right.
And sometimes I'll tell them, why don't you stop taking everything and reintroduce one or two at a time, or let's do some blood work and see where you're truly deficient, and then let's decide, but there are definitely ones you need with others, right? They work together. It's important to understand, you're going to absorb things better when you take something else with something else,
right.
or the opposite. If you take too much of something, it's going to make something else low. So we've got to be really careful with how we utilize supplements.
Okay, it's just, I feel like I'm on supplement overload.
Yeah, we laugh. Sure. We say, we just have expensive urine in those situations, right?
Neon green, neon yellow. Yeah. Yes, absolutely, very expensive urine for sure. Well, I have to tell you, your patient told you today that. I wrote it down earlier that they felt heard for the first time in their journey. And you were one of those. Remember when I came to you probably 5 or 6 years ago, however long it goes, and I just was struggling because I had my my rheumatologist tell me, well, I wouldn't have my wife get rid of her breast. And well, no joke. But, and it's all in my, have you talked to your therapist? And then I had every single doctor say, well, it's just menopause, or you have irritable bowel or whatever. You were one of the first that said, you know what, go take a look at Dr. Whitfield down in Austin. Go and check this out. And that you did that, you gave me hope. So I know how this woman felt, and I don't know if she's just, but it's a gift. You women, I don't know any men in this area, but women just, the connection and the gift that you give doing what you're doing is amazing.
Well, thank you so much. And I love my male patients just as much as
I
love my female patients. But I do think, women sometimes they get lost in the shuffle, especially this perimenopausal, postmenopausal. They start saying, well, just, to your point, go see a counselor, or here's an anti-anxiety medication, or, instead of, hey, this could be just some nutrient deficiencies or some thyroid insufficiencies or hormonal imbalances that we can, there's things we can do. More than even just a pill, it's not about that. There's lifestyle things we can do, exercise we can do, we can help you get sleep, things along those lines. So.
And like you said earlier, this is not medical advice, and I have more wellness on this show than anything, and it's fabulous. But I'm not a doctor, not a medical professional, but I've talked to a lot of them. But there is a time and place for conventional medicine, of course.
Absolutely.
There's a time and place for pharma, of course.
Absolutely.
But I look at my arsenal that I was taking when I was just so lost and go, oh my gosh. But I was told recently, just to recent stress, let's get you back on, Wellbutrin, or let's get you on, and then, and I'm like, no, I don't want to do it. And my functional gal said, why don't you do the dissolvable progesterone underneath your tongue? I'm a new freaking woman.
I love that. That's amazing. Yeah.
It changed my entire family will tell you. All my team will tell you. They want those.
But do you know why? So what happens when your cortisol levels are high, cortisol counteracts progesterone. So it makes your progesterone low. So that's why you're getting those symptoms. But if you give yourself progesterone, that is going to help with those symptoms.
It was amazing. I'm like, I don't want to take a pill. I just don't. I don't want the side effects. And I've done that. That. But I put that little thing in, that little pink pill underneath my tongue, and I just feel like, happy girl.
I love that.
Isn't that fun?
That's so fun.
So anyway, awesome. And I talked about that last season on the podcast, and people are like, what is this?
Wait, I want one.
Exactly. Okay, so Restore and Revive, y'all are just thriving and vibing, and I have friends that go over there. I've been to Ozone. I've done it all, but anything new on the horizon? You've got Pilates, like I said earlier, but
Yes, yeah, great question. We're actually building a building across the street from us, and we're going to move our pediatrics over there, really overemphasize and work on our pediatric growth, which we're super excited about. And then we'll be able to move some of the modalities that we have in our current building over to that space. We have an amazing counseling department, and so they're growing and outgrowing and all the things, which is amazing. We're going to add a larger fitness facility, which will be awesome. And I think, there's some really cool stuff I'm not quite ready to talk about yet, but some really, really neat things, including our first location outside of Texas. Another really cool concept that we could not be more excited to be a part of, that's in Texas, but in a different city, and we're really, really excited to just continue growing and having opportunities to help more people.
Good.
So,
well, I'm so proud of you. I'm proud to call you my friend,
Thank you.
and just what you offer to this area, and obviously going beyond in Bloom. Okay,
Thank you so much.
We have in the show notes how you can find Dabney and Restore and Revive. So it's all in the show notes, y'all. But just follow along. We'll have all this information. Thank you for coming.
Thank you for having me.
Absolutely.
So fun.
And y'all know I say it every single Tuesday. I mean it. Keep being fabulous.